Right, so I'm watching the big clown show here, breaking this up into a couple smaller videos, but still nonetheless very important here what Deborah Burke says. And this is what I have been massively warning people about, is this massive sort of surveillance grid in which everyone is tested everywhere. So listen in here, because they asked Trump about this, and then he brings Burke's up sort of thing to answer the question, and listen closely to what she says. Here we go.
Public health experts have said that this would be better done if there were comprehensive surveillance testing, which we're obviously not in position to do. I wonder if maybe Dr. Birx and Dr. Fauci can tell us whether they feel comfortable.
Dr. Fauci and I will do it together. I just wanted to, that's why I wanted to put up the syndromic and the influenza-like illness piece. Because what is key in this is the early alerts and getting in there before they even know they have a problem. And I think CDC has been remarkable in building these platforms. Dr. Redfield
Dr. Redfield.
So they're all on the same website. If you look at COVID-19, you go into cases, you can find all of the data. And the beauty of it is the states are used to utilizing that through flu season. So the testing and contact tracing, and Dr. Redfield will be putting people in every single state to make sure that CDC is standing beside the state and local health officials to make sure that all of those cases are immediately identified and contact traced. I think what's new and what's really critical is this constant sentinel surveillance for asymptomatic individuals in communities that we...
Now, I have the caption there. If you just listen very closely, this constant sentinel surveillance of what? Asymptomatic. This is people with no symptoms. So listen closely.
Website, if you look at COVID-19, you go into cases, you can find all of the data. And the beauty of it is the states are used to utilizing that through flu season. So the testing and contact tracing, and Dr. Redfield will be putting people in every single state to make sure that CDC is standing beside the state and local health officials to make sure that all of those cases are immediately identified and contact traced. I think what's new and what's really critical is this constant sentinel surveillance for asymptomatic individuals.
Constant sentinel surveillance for asymptomatic individuals in the community. They're basically telling you that everyone is going to be tested.
What's new and what's really critical is this constant sentinel surveillance for asymptomatic individuals in communities that we know are particularly vulnerable. And that hasn't been done in flu before. And I think that's going to be the added dividend that's really focused on who is most vulnerable and how do we get the fastest alert by generally screening people without symptoms. So people who are just...
Generally screening people without symptoms. Wow. It's hard to just get this right back because it's live sort of thing. So
do have enough testing capacity to do both that surveillance piece as well as the diagnostic piece and contact tracing.
I'll get back there for a second.
And I think that's going to be the added dividend that's really focused on who is most vulnerable and how do we get the fastest alert by generally screening people without symptoms. So people who are just coming to the clinic will be screened for COVID-19.
So just people that just come into the clinic, you could be going to the clinic for anything. You'll be screened for COVID-19. Along with the contact surveillance. The language is key here because she's saying this is for all 50 states and that they're all going to do this. This is the surveillance system that they're laying out with this first wave of COVID. It's really something. So they're going to force asymptomatic people with no symptoms to take these tests. And anybody that goes to a clinic is going to take these tests, basically. I'll just play that little part again and try to get it right on there, hopefully. I need to get back a little bit.
Alert by generally screening people without symptoms. So people who are just coming to the clinic will be screened for COVID-19. And we do have enough testing capacity to do both that surveillance piece as well as the diagnostic piece and contact tracing.
Just a follow-up, John, if you want to say something. No, actually, people have gotten confused about that because in the beginning when we were focusing really on just mitigation and really trying to keep peaks down and trying to worry about ventilators and PPEs and things like that, when you get a little bit more grace period, you can start figuring out what is the penetrance of this virus in society. What are we missing in people who might be infected? What is the percentage of those people that are out there? That's going to inform us greatly for a number of things, including the level, once we prove that antibody test that you have is really protective, and we still don't know that yet, we're going to find that out, we may get a good feel of what the level of protection might be in society, but we don't know that yet. So it's going to give us information as to what the vulnerable areas are and how we need to respond. Remember, there's two types of things: antibody tests and tests for the diagnosis of who has the disease. One you need for contact tracing, the other you want to need for finding out what's in society. We're going to...
These people, this is the medicinal martial law that they want to implement. They are very clever by using a virus to do this, right? But this is their goal. Their goal is just to have everyone being watched at all times. And they have to justify it. And the way that they justify it, of course, is by scaring the bejesus out of you so that you all fear this invisible enemy. Right? And you do exactly, in fact, what happens more often than not is most people are watching their television and they are, bending over backwards to do whatever the government tells them to do without a moment's thought about what this actually means. So when they're testing you and they're going to be, getting your DNA basically amongst, right? I mean, they're going to have your contact tracing, which you're going to be forced. I'm showing you this. Like, I'm not speculating. Like, I mean, I don't mean to say this to people listen to me because they know this, but I'm saying, like, if you're skeptical about what I'm saying about how things are going to proceed in this new world order, is that you're not going to be able to access places. You're not going to be able to go into places without the contact tracing on. So you're going to have to use your phone to get through checkpoints, to get into the store, get into the doctor's office or the health clinic or the hospital. And then you're going to be forced to take the test even if you're completely asymptomatic. That's what these scumbags are saying. So be very, very wary of how this is all playing out and how many of our rights this actually violates. It's hard to really put it into... I mean, it's just mind-boggling what they're gonna do if we allow them to do this sort of thing. We're gonna be constantly living in fear. You're gonna get those alerts all the time on your phone. Well, I mean, I showed that too. Going back weeks with the contact tracing, and they're making it look like the whole contact tracing just came out of nowhere, and it's all these creative people. But it's in every single country, and every single country around the world is developing the exact same type of apps, and they all just started working on it, and they all just came up with the exact same idea, and isn't it great, and wow, isn't this going to be the solution? When they deprive most Americans of work, now the Americans are out clamoring, demanding that the government let them go back to work. And they're going to say, okay, yeah, you know what? We want to get you back to work here. So how about you do this for us and then we can get back to work faster? You see? They might even be helping amp up the whole get back to work or, get America back on sort of thing in order to roll this in. Because if you get enough people freaking out, I mean, think about the shenanigans that they're up to. They shut down enough business. They squeeze people enough. They're not. Maybe their objective is not to squeeze them and completely destroy them, but just to squeeze them enough that they'll do exactly what they say. They say, okay, you want to go back to what we had before? Okay, let's do it. But here's the catch. Here's the catch. We need your saliva. We're going to stick this thing up your nose. Right? You're going to have to go around with your smartphone. You're going to have it on. We're going to have the 5G towers around watching everything that you do. And every place you go into, you're going to be traced. And if there's some sort of evidence that comes out that somebody in one of the areas that you were in was infected, well, guess what? Right? At your door, forced quarantine. So, I'm paying very close attention to this. I might do a live show later tonight. If I don't do one, I'll definitely do one tomorrow. For sure, 100%. But I'm going to try to get some shorter vids up and just, for the folks that don't have the time to watch the big live shows. And I'm working hard behind the scenes. Hopefully, if you like my work and you're not yet supporting me, you can sign up for my Patreon below. It really helps me, as this is my job now that I lost my real job to Corona. But I'm doing the best that I can. And you guys are awesome. God bless. Keep strong. Get this information out. Share these videos if you can. Get people talking about stuff, and get people questioning, scrutinizing. Leave no stone unturned. Everything, all our lives depend on this sort of thing, and we cannot sleep on this at all. We have to be ever vigilant, ever watchful. Sharing information. So huge thanks to all the people that are constantly supplying me with great information, and fight the good fight, be the change you want to see. I'll see you guys all on the next one. Take it easy, folks.